here in Chisholm, of course, as I said, the margin is 3.3%. So any change of direction from voters could very much change this seat from Labor, which won it last time, off the Liberal Party. We've got Karina Garland up against Katie Allen. We spoke to Karina earlier. Katie in a moment, but first of all, we heard from voters, first-time voters, and some with very strong views already. Have a look.
I haven't really had too much of a look, but yeah, I'll have a think when I'm in there, yeah.
What policies do you care about?
Probably most about HECS debt and stuff like everything about uni, to be honest. Anything to make my life easier, I guess, so yeah.
Are you aware of HECS debt policies?
I've seen a little bit about it in ads and stuff, but yeah. I haven't really had too much of a deep dive look about it.
No, fair enough. Lots are in that boat. I feel like I shouldn't sway your vote and tell you what they are, but there are a couple out there. What about housing? Do you think, how the hell will I buy a house one day?
Yeah, but I haven't really been thinking about it too much, so not yet. Comfortable living with mum for now, so yeah, all good.
I was just saying to Archie this morning, I'm just a bit tired of the whole thing, to be honest. For me, I'm a GP and I do not like the rhetoric that's out there at the moment. This see your GP for free rubbish. We're all private businesses. We're private people trying to run our own private businesses, so I'm not too sure how the government think they're actually going to do that.
So they talk about 90% and you go, well, you know, whether I take that up or not, you're worried people walk in and go, give me my free doctor's appointment.
Yes, that's what's going to happen, and it's asking us to take a pay cut. So, you know, we're trying to run a business. We are on the edge trying to run a business and trying to keep people fit and well and healthy, and they're making empty promises that both sides. I just don't understand how either of them can say, we're going to make sure you see a GP for free. It makes no sense.
Because it was matched a few hours later by the coalition.
Yes. I'd like to see them actually talk to us and see how that's going to work. We're all private businesses and they rely on us to keep people out of public hospitals. It's this constant stoush between the state and federal government with funding for health, and they're relying on us to keep people out, but they're not making any, I guess, adequate promises that are actually going to work.
Neither party's super impressing me, so maybe go the independent.
Yeah, okay. So have you sort of looked at policies before you've come in, or you're just not sure which way you'll go?
To be honest, I don't think there's any new ideas, and I think the electorate's probably a bit frustrated that there's no personality that people really want to get behind. So it's a bit of a null election, a bit of status quo. Hopefully some new personalities can come through in the new cabinet.
So you're uninspired?
Uninspired, yeah.
So interesting, a doctor not happy with that Labor policy, saying in particular after she works in women's health, and longer appointments are needed, and this Labor policy won't help that. So interesting reaction.